Hey guys, this is your welcome aboard video. I'm going to show you guys exactly what to do with your kit the first time you have it. A lot of times what happens is guys, they get our kit in the mail and they're like, yes, and they're so excited and they open it up and they're like, oh my God, what have I done? Because there's a lot going on in some of these boxes, okay? None of this stuff is complicated, but some of it's not the most intuitive. And I'm here to show you guys exactly what to do with whatever medications that you guys get, okay? So most of you guys are going to be getting stuff from Hollandale Pharmacy. There are some exceptions to that rule. So if it's not a Hollandale box, don't worry about it. The exceptions can be based on some specific medications you may need or where you may live. The primary kit that most guys are going to get is going to be the testosterone. It's going to be enclomiphene, and we use that enclomiphene again to take care of testicular health while we're on our program. And some of you, not most of you, but some of you will get anastrozole to help manage estrogenic side effects, okay? Also, if you get testosterone, you're going to get a bag of needles. And so I'm going to set the rest of this aside. So the first thing we're going to talk about is our testosterone. The testosterone comes in a 5 ml vial, and it comes with a lid that's sealed on it initially. So the first thing we're going to do is pop this off. It won't go back on at that point. And then we're going to get our bag of needles. We're going to pull one of the needles out, and this is how you administer your testosterone. Twice a week, typically on a Monday, Thursday rotation, you're going to draw up 50 units, which is 1/2 of an ml. It's a 1/2 of a cc of whatever strength that you have. Some guys will have 100 milligram or 150 milligram or 200 milligram testosterone. Regardless of the strength of your testosterone, everyone's going to draw the same amount. Okay, so open the needle. Turn the medication over, insert the needle into the rubber stopper and draw it. And we're going to allow this to get to the 50. That took about 30 seconds. It's not that bad. Now, what we're going to do with this needle is we're going to administer this subcutaneously in the belly fat. What I typically recommend is pinch some skin. Don't try to go between your fingers, okay? Especially if you're lean, because the skin is going out and back under. And it's very easy to deposit this in the actual layers of the skin and not in between the two layers. So the best advice is to go above your thumb an inch or so and then just administer this. You can also do the hip, the glute, the thigh, wherever is most convenient and comfortable for you is the right answer. And again, remember, we're going to do this 2 times a week on Monday and Thursday. When you take this, everyone is going to also have enclomiphene. And clomiphene will come in either capsules or little tablets. Take one of these every single time you take an injection of testosterone. The anastrozole is going to be very patient specific. Some of you won't have any. Some of you will have 1 a week. Some of you will have 2 a week. If you're 1 a week, just take them on Mondays. If you're 2 a week, take them obviously on Mondays and Thursdays with your testosterone. That, guys, is how we manage our testosterone replacement protocol for most of our patients. The next thing that we give a lot of guys, especially because we give out our free 8-day trial, and if you didn't catch that, give us a call. We're happy to get you back on it. But our daily use Cialis is one of the best drugs that we have as far as results go. Most guys that get on this absolutely love it. Let me show you what it looks like. It comes in this waxy form. It's called a troche, and these are scored to be cut into 4s, or you can just bite off a quarter of this. Don't take the whole troche. Every one of these troches is a 4-day supply, okay? So if you got our 8-day supply, you're going to get 2 of these. And if you get our normal 35-day supply, you're going to get 9 of these troches. So make sure just to take a quarter of these. And that's as simple as it gets for our daily use Cialis protocol. The ipamorelin is a little more tricky than the other pieces of the protocol, and I'm going to show you how to administer it. What makes it more tricky is it comes in this lyophilized format. It's basically a freeze-dried format. So you'll notice a powder in the glass vial, and you'll also notice that you've got some water in a sealed bacteriostatic container as well. So we need to get the water out of here and into here. So pop the top off of both of these. You're also going to get a mixing needle. Please don't use this to inject. And I say that because it has happened before. Pull it out like this. Make sure that the needle's on tight. Give it a nice snug turn to the right and go ahead and pull that off. We're going to draw 9 mLs of water from our bacteriostatic vial and put it into our glass container with the ipamorelin. And there you have it. We have 9 mLs of water. And when we put this in our tube, there's a vacuum that should be in place in this vial. You can see how that vacuum is pulling the water into the vial. This is because when these things are sealed, they're sealed in a vacuum. And so if you do this and insert the needle and it doesn't pull it, that means that that seal has been compromised and possibly the sterility. So don't ever use that vial if that's the case. But just like that, now you have your ipamorelin. And guys, one thing to keep in mind, these tips, you can throw these away into the trash as far as the syringe go. These tips, we want to manage these tips. So we ask that you guys buy a sharps container, use a gallon jug or a protein container or something. Always cap these needles and these tips, put them in some kind of a hard plastic storage device and make sure and tape it up before you get rid of it. You can also take it to your doctor or some kind of local clinic that'll dispose of it as well. But once we get this mixed, now we have 35 days supply. We put 9 mLs of water and we administer 0.25 or 25 units on the needle each night right before bed. That's how you do the ipamorelin program. And guys, again, if you're looking to add muscle and lean out as fast and as easy as possible, this is a fantastic adjunct into our program. And the very last thing I want to show you, many of our patients get the Bio Boost. This is a B12 lipo mix. There's several components of it. It is a 1 ml injection. Some guys take this once a week. Some guys take it twice a week. It depends on your blood work. Talk to your practitioner about how often you should be taking it. But it's another easy peasy administration. Turn the vial upside down, insert the needle, draw it up. This is going to be a lot faster than the testosterone. You can see how fast and easy that was. But again, you can administer this anywhere you want. Subcutaneous, shallow IM, wherever it's more convenient for you and more comfortable for you. That's the right spot. That's how we do our B12. So this covers the majority of what most guys get from this. We have 100 other products that some guys get here and there. Obviously, I can't go through all of them in this video. If you are getting another product that has specific instructions and you have questions, please don't hesitate to ask. And I hope that this answers most of your questions about how to administer the program. Like I said, if you have any questions, guys, we're here for you. We'll talk to you soon.